Many a times we notice many of our friends, relatives, family members who have a small bump on their neck, and it is almost presumed to be a part of their body. And that's how their neck is. So it is most of the time they have a simple thyroid nodule. There's a thyroid gland sitting on the neck which has a small bump in it, for which the throat will be looking little projected. This is a simple nodule, and these, when they go to many doctors previously and they examine, and to diagnose what is the problem, they get an ultrasound scanning done, and the ultrasound scan would show a nodule, and this nodule would not be cancerous, a very simple nodule. And most of the doctors would have suggested that nothing to worry about, just leave it. So now that wait is over. No more waiting for the thyroid nodule to become a cancer on a later stage of your life, and then you go behind at getting the thyroid gland removed. Before that, when you see the nodule is now, we can treat with intervention radiology, akin Scarless, daycare, and you can resume work the next day. So this will not hinder your daily activity, and also this procedure is very simple. There are two main treatments that we can offer from intervention radiology to treat these thyroid nodules. One, if you have a small nodule, we will just put in a small needle into the nodule and burn it. This terminology is called as ablation. In ablation, there is heat generation that happens. Very focal area. 3 mm, 5 mm heat generation within the nodule. And that shrinks the nodule over time. For 1 to 3 months, this nodule will start shrinking and it dies off. Then another form of treatment is embolization. When do we consider this embolization? Now, if you have multiple nodules throughout your thyroid and the whole neck is bulged, so we cannot keep on burning all the nodules. It's a very cumbersome procedure. During this time, we prefer shutting down the blood supply to these multiple nodules. Hence the lack of nutrition in this nodule, and the nodule starts shrinking. And this is a very simple process. It does not involve any prolonged hospital stay. There is no cut on your neck, there is no scar, and it is ultra advanced technology that has been used. In embolization, we go into the blood supply of the thyroid gland, whereas in ablation, we directly get from the skin into that nodule and we burn it. So if you see a lump in your neck or any of your friends, family, relatives' neck, do not ignore. First thing that you have to do is get an ultrasound scanning done. And in that scanning, we get to know how many nodules, where it is placed, and what category it is falling into. Then you may need an FNAC, where this is a fine needle cytology, where a small needle is passed, and we get to know whether this lesion is cancerous or not. Once we know what is the type of the lesion, then the treatment is planned. And the most advanced Scarless daycare procedure that we have is thyroid ablation and embolization. If you are a suitable candidate for that, we have the state-of-art facility at Apollo Hospitals. Thank you.